Thanks very much, Chief. I want to be very clear on a couple of messages. This is going to get worse. There will certainly be more cases, and we will certainly have serious cases. But there is no reason to panic. As we watch cancellation of events around the world, as we see the social media posts, as we see the inexplicable lineups at the grocery stores for toilet paper, it's easy to get very, very nervous, and it's easy and correct to be looking for answers. But I want to tell you something. If you're here in Calgary, you're in the best place in the world to deal with this pandemic. We're in a place where government works. We're in a place where we have a robust public health system, and we're going to look after one another. It's important that we keep everyone safe. Ourselves, our family members, our loved ones, elderly people in the community, ultimately everyone in the community. Let me say that one of the reasons I'm feeling really grateful is I feel that we are so lucky to have the Chief Medical Officer of Health, Dr. Gina Henshaw, and her entire team, including the Acting Chief Medical Health for Calgary, Dr. Nick Etches, working so hard and being such incredible resources for all Albertans as we navigate the early moments of this pandemic's presence. Under her leadership, under Dr. Henshaw's leadership, the province is making important decisions to keep us all safe and keep us all informed, and I'm confident that we are in good shape. Now, you know, this may seem like an overreaction. And let me tell you something, maybe it is, but it is an intentional overreaction. Because when we think about how pandemics spread, when we think about that curve and that catchphrase you keep hearing, flattening the curve, it means pushing cases out further, pushing them out for when seasonal influenza cases are no longer clogging the emergency rooms, when we have more treatment and more prevention options, and overall, not overwhelming our healthcare system. These are the things we've got to do. We've got to do them quickly, and we've got to do them now, and it relies on everyone's participation in social distancing, in good hand hygiene, and all of that stuff to make sure that we are pushing out the spread of this disease as much as we possibly can. And things change. So, you know, in my own case, as you know, I travel a lot, and I certainly spend time with lots and lots and lots of Calgarians. And so although I recently returned from India, which is not considered a COVID-19 hotspot, in fact, when I left, the entire nation of India had fewer cases than Canada. Nonetheless, out of an abundance of caution, I may have had a little bit of the sniffles. I phoned 811. I did it in the middle of the night because I'm a night owl, so it took about 30 minutes to get through. And the very kind nurse went off a list of symptoms, and we talked about how I was feeling, and ultimately she said, no, you're clear, you don't need to be tested, you're good to go. And I was very happy to go through that, and I was more happy to be healthy. Maybe things will change. Today's information says people now returning from international travel should self-isolate for 14 days, even if they don't have any symptoms. So this is a very fluid situation, and it's a situation that we need to continue to look at every day. But I want people to make sure that you're taking care of yourselves. Clean hands, clear heads, open hearts. Clean hands is easy. Wash your hands frequently, use sanitizer when you can't wash your hands, cover your cough, and as you can, isolate yourself from people who are ill. And if you yourself are ill, even if it's not with this virus, stay home. You don't want to compromise anyone else's immune system. Take special care with elderly people, because as we know, this is difficult for elderly people. Oh, I should have mentioned that if you do call 811 and you do have to be tested, don't be scared to call 811. Don't think this means 14 days of isolation no matter what. It's a good process. You'll go through the list. If you have symptoms that need you to be tested, there are testing centers set up. It'll take 5 minutes to be tested. You'll isolate yourself until you get the results of the exam, which takes a day or two. But ultimately, it's a system that is working and is working very, very well. Now, the risk here is still low. And Dr. Henshaw confirmed today that we haven't had any cases of community transmission in Alberta. That means that everyone who has it in Alberta has got it somewhere else, and they've traveled here. The longer we can prevent that community transmission, the better we do. And that's why we're taking this intentional overreaction now, all about keeping the risk low, all about flattening the curve, all about reducing the risk by spreading out the ability for the virus to spread. It's all about keeping the healthcare system safe and able to help everyone. We can't be in a situation where someone who has a cardiac event can't get into the hospital because it's full up with people with COVID-19. So these are the things that we've got to do, and we each have a responsibility to do that. Employers, organizations, and every single one of us as individuals. So again, clean hands, clear heads. There's no need to panic, but there is a need for action. And most important, open hearts. This is a community issue. It's an issue about all of us. So go and look after the seniors in your neighborhood. As facilities start to close or as events start to get canceled, they will feel isolated. They need to know that they live in a neighborhood where people care about them. If you know people who are in isolation, drop off some soup on the doorstep. Don't go in, but drop off soup on the doorstep. Call them. Check how they're feeling. Make sure that people remember that there are other people looking after them. So clean hands, clear heads, open hearts. All right, we'll take questions now.